Good afternoon. My name is Frank Haney, Winnebago County Board Chairman. I am joined again by Rockford Mayor Tom McNamara and Dr. Martell, the Winnebago County Public Health Administrator. The state of Illinois today reported that there are now 22,025 confirmed cases of COVID-19. That is up from 100 cases confirmed on March 18th. That covers 87 of the 102 counties in the state of Illinois. As of 3 p.m., the CDC is reporting 588,000, almost 589,000 confirmed cases, up from 9,400 cases nationally as of March 18th. We come before you a couple of times a week at the local level, local chairman, local mayor, and local public health administrator to share what we know. We also attempt to answer questions that we're hearing from the community, and really, as this goes on, separate things that might be facts from myths, and sort through and work through with you in the community as we go through these unprecedented times. I want to step back for a minute. You know, at the beginning of March, we heard these type of statements, although in a portion of our community, a portion of our state, and portion of our country, we heard people dismissing this challenge as a hoax. And clearly we know now, all due respect, that this is not a hoax. We heard people saying that this was a really small thing. And now today we are closing in on 2 million cases globally. That doesn't mean we're not making progress locally and at the state level and nationally. It just means that this is not a small thing. We heard comments made early on that this was somehow contained to a particular country, to a particular part of our country. We know that's not the case because 87 of the 102 counties in the state of Illinois now have a confirmed case. We heard distraction comments that this was somehow a media concoction or a political fight. I must say this, one of the things I'm the most proud of locally is that I think the approach we've taken in the Emergency Operations Center is one of working through tough circumstances that are unprecedented. The approach I see by the people to my right, your left, Dr. Martell, Mayor McNamara, all of the mayors in this community, all of the public leaders in this community, is really focused on getting through this in a manner that saves the most lives, is the best on the public health side, and also helps us position ourselves to reopen businesses fast as possible, fast as is reasonably and safely possible. The same is also true here, that let's talk through and just get comfortable with this fact, that when we get our information from experts at the national, state, and local level, as we learn, as things change, and also as we make progress on flattening the curve, and we have, and we should be proud of that, that models and projections should and will be relooked at and revisited. That is a sign of success. That is not an excuse or a reason to go back to the beginning of this conversation and somehow try to minimize this as not as important as it truly is. That is the surest way, in my opinion, for us to be back in a really tough situation or to see this go on longer than it should. We have to take this seriously. As we go forward, there's questions I'm hearing in the community. I'm hearing questions such as, why are we not talking about recoveries when we talk about confirmed cases and deaths? And I'll leave that specifically to Dr. Martell and to the mayor if they want to add anything. But here's what I, as a layman, not as a public health professional, how I see it is these numbers, the recovered numbers that I see globally and nationally, they lag far behind people that are recovering. We know this, that the majority of people that get COVID-19 will recover. We do know that. We also know that people who have underlying conditions, people who are elderly, are more at risk of not recovering from this, and we're seeing that play out across our country. But we do get these questions from our community. One of the things I want to talk very directly as a layman, as a community leader, and as a person raising a family in this is when I see repeated questions around the death numbers related to COVID-19. And again, I'm speaking as one person up here, and just for myself and my point of view is I find it very troubling when For a month now, we've been saying that folks with underlying conditions are at most at risk. There might be a more artful way for a public health administrator or professional in medicine or public health to say that, but could not be more clear. When we see evidence that that has happened in some cases nationally and in our state, and perhaps even here locally, that it is disconcerting to see people misunderstanding what that meant and suggesting that somehow numbers that are being reported are not accurate or do not reflect reality related to the seriousness of COVID-19. That needs to stop. And if you have very serious questions, especially if you are a state senator, please call. Please, let's talk through that so that we don't confuse the public. Every piece of information I've seen shared by local folks is absolutely aimed at providing accurate information. When we talk about confirmed cases, my understanding as a layman is that these are folks who have had symptoms and their clinician has wanted them to be tested, and they tested positive. That is not to be confused with folks who had mild symptoms and their clinician made the determination, not a chairman, not a mayor, not a state senator, but that their clinician made a decision not to test them. And again, Dr. Martell, if there's a more artful way to share that, we just want to make sure we're providing information. Not everybody that has some level of symptoms has been tested to date. That does not mean they're not getting accurate guidance from their clinician to stay home and recover. When you look at testing, there continues to be questions about testing. We know this, that there's only been 105,000 plus tests conducted across the state of Illinois. I believe the governor wanted to be up at 10,000 tests per day. I believe as of late last week, we were at about 8,000 per day. That's a great improvement over the last several weeks, but it's not where we want to be. We are going to continue to learn as a community locally and across our state and nationally as more tests are conducted. Questions have come up about a vaccine, and again, speaking as a chairman with a family in this community, of course we need a vaccine. That is what we all want. That is not to be confused with testing. That is not to be confused with the idea that it may take several months. Some have, in the public health community, speculated upwards of a year to arrive at a vaccine. If that information changes, I guarantee you the people up here with me will be the first to share that great news with the community. There are also a large number at any given time of pending cases. Those are people that their clinician has determined they need to be tested with COVID symptoms. Their tests have been taken and we're waiting to hear back. The health department is waiting to hear back on the results. My experience, and if Dr. Martell wants to provide more specifics, she certainly is free to do so. There could be anywhere from 250 to 500 pending tests that I've observed over the last several weeks on any given day going on in our community. So when you hear that there is a number of new cases, that is a part of the story, but not the whole story. I do want to talk briefly here about information I heard from the state of Illinois today related to the Illinois Department of Employment Security, IDES. Since early March until April 4th, there's 513,000 new unemployment claims filed in the state of Illinois. And that is a very large number, the largest 5-week number that we've ever recorded in our state's history. That is a 400% increase on the first 5 weeks of the Great Recession. People and small businesses are hurting, and that is a big piece of this discussion as well. So when we come before you, we are trying to share very accurate information with you on multiple fronts. Number one, the public health front. Number two, on the economic and financial front. This is a two-front war. One quick piece of business on the governor's order that's in place through April. I have been asked multiple times in the community, and I just wanted to put it out there. I want to thank the health department and city legal and the Winnebago County State's Attorney's Office for providing assistance around interpreting some of the order. There is a specific language in the governor's order that speaks very directly to the sale of marijuana. And when the governor wrote in very directly that marijuana can be sold at this time, then it's in the order, it's not up for interpretation. So that is not a judgment call local folks have made. That is specifically, my understanding, is in the order. And so that is, as that question comes up, I'd rather put that out here in this briefing so that you know where that decision came from. And also understand that I'd want to share it broadly with the entire community because it is a question that comes up. There are other parts of the order that are more broadly written and do require or need for local interpretation to take place. I will finish briefly with this. There is some really good news coming out of our Emergency Operations Center. We're excited to announce that Winnebago County Emergency Operations Center, in coordination with the Salvation Army, is opening a COVID-19 donation center. The center is located at the former Circuit City at 5460 East State in Rockford. The center is opening starting tomorrow and will be open weekdays from 10 a.m. until 2 p.m. The center is only accepting certain items such as paper products, cleaning supplies, laundry supplies, homemade face masks, and PPE. A complete list can be found on the Winnebago County Health Department's website at www.wchd.org. Non-PPE donations will be distributed to agencies serving the homeless and those in need during the COVID-19 crisis. PPE donations will be given to local healthcare facilities. When dropping off donations, it's important to note, community members will stay in their car. Masked and gloved volunteers will collect the items from the vehicle. Donations should not be dropped off outside of the staffed hours. Special thanks to IBEW, the International Brotherhood of Electrical Workers, and Alan Golden, National Electrical Contractors Association, Fitzgerald Equipment, Rockford ShareFest, and First Free Rockford, as well as numerous other community partners.